Hi everybody, Dr. Joe here. Today I'd like to talk to you a little bit about veterinary medical manipulation. Some of you may be unfamiliar with what veterinary medical manipulation is, but you're more familiar with the term animal chiropractor or veterinary chiropractor. They're very, very similar. The reason I cannot call myself an animal chiropractor at this point is because I am not certified by the American Veterinary Chiropractic Association or the International Veterinary Chiropractic Association. In the state of Ohio, I must be certified through those two organizations, one or both of those organizations, in order to consider myself an animal chiropractor. But the veterinary medical manipulation is very similar. So a lot of it is semantics, not to disregard those who are certified through those two organizations. But that does clear up a little bit. Hopefully that clears up a little bit of information for you guys regarding how they are similar and how they are different. So what is veterinary medical manipulation, or what is animal chiropractic? It is using small, very, very small, quick adjustments to remove restrictions within a joint. So what does that mean? I use something called motion palpation, which is where I just take the joint through a simple range of motion movement to find out, does it move as far as it should? Can the pet move its neck one way or the other, the way that it should? Can they move their shoulder? Can their vertebrae in their back move like they should? And if they cannot, then we consider that a restriction. And so to fix that, we use a very small but very quick, so high velocity, low amplitude thrust or movement in order to get that restriction to go away. So I'm sure everybody has seen the videos on social media where they take the dog and they have them by the kind of the neck and by the back end, and they kind of bend them in half, and you hear this lovely crack, and the dog looks at the person who's doing it like they kind of want to bite their face off, and then all of a sudden the dog is fine. That is not what we do here in the United States. No institution that teaches animal chiropractic, veterinary chiropractic, or veterinary medical manipulation teaches those. I hate to even call them techniques. Those are not safe. Those are what we call long lever techniques. And those are not what is taught in the United States. So stay tuned. I would like to have some videos of me going through motion palpation, me going through an adjustment so that you can see exactly what it is and how it looks like. But that is not it. So who benefits? Who benefits from veterinary medical manipulation? Who would be my ideal patient? And really it would be any patient. I tend to specialize in geriatric patients with my acupuncture practice, but that does not mean that veterinary medical manipulation is simply for geriatric patients. Young patients, I have a 2.5-year-old lab at home, and I have been adjusting him through my course. And at 2.5, you would think, what problems would he possibly have? But he does. He has some restrictions in his neck. He has some restrictions in his pelvis. He's a wild and crazy boy. And so he tumbles down the field, down a hill, he runs and plays with other dogs. And so those can cause restrictions. So your 2-year-old, your 1-year-old, your 7-year-old, they may have restrictions that may be causing them problems. And it may not be causing them problems in this moment, but it can definitely cause problems down the line. I'm trying to keep these videos a little bit shorter so that you can pop in and you can pick a video and you can watch it in between events that you're attending for your kids or for your pets. And so I will have another video exactly how it works kind of on a more anatomical level, but stay tuned for that one. So how do I know? How do I know if your pet needs an adjustment or not? And it's that motion palpation again. So what we would like to do when we start seeing appointments is we would like to set you up for an initial consultation. In that consultation, your pet will get a full physical exam and then a motion palpation exam. And so I will go through every joint in the body from the TMJ all the way down to the toes on the front and back legs and see, are there restrictions in those joints? Do those joints need to be adjusted? And then those joints, those restrictions, any restriction that is found will then be manipulated and adjusted. It's unlikely that I find zero in any pet. We haven't, through my course and through my working on my patients, I have yet to find a patient who has zero restrictions. Similar to your chiropractor, it's probably unlikely that you have zero restrictions when you go to your chiropractor. But stay tuned for our next video explaining a little bit more detail about what it is. But here's just a short one to kind of give you an intro to it. So thanks so much. Bye.